people along the way. It's good to see a good turnout on a public holiday as such in Geneva, and your commitment to global health is recognized. Our chair, Dr. Neda, and she will introduce the board, and then we will invite Dr. Sinad from Kiribati. Many of you have been checking up on Kiribati. You have noticed some of the most positive things about Kiribati. This is the island shortly after the international deadline. So whenever this year and for the rest of your life, you gather with your friends to mark New Year's on 31st December every year, you will always remember about Kiribati. And I take a cruise to Kiribati and help. So it's a new part of got humanity and compassionate healthcare that we all deserve. We have lost in many health systems. They retain the essence of healthcare. So over to Neda to introduce the board, and then we'll invite the minister. Thank you.
Thank you. Good morning, everyone. As Kavadip mentioned, we are happy to have you here. Luckily, we have a hybrid event join us. The world changed. We now have a chance again to remember the events where we can try to do that. On behalf of the board, I would like to welcome you and just briefly introduce the people who really took the organization through the pandemic together with the office. From the UK, Liliana from Argentina, BC Bright from Nigeria, on this side Paul from Philippines, and Orajit from Thailand. So you can see, and I'm Neda Milevska-Kostova, coming from Macedonia, representing also European region. We have two board members missing. One has joined us online, Elos from Malawi, and Lara Bloom, who is on the way here, again, due to some strikes, flights being delayed. She's also from the UK, partly US. So as you can see, we try to represent all different regions. We try to represent the voice of those regions through the board members. So please talk to your board members as well, if you have anything to share. And please use this opportunity to talk to us. Let's exchange. Let's try to make the patient voice heard. Thank you very much, and over to Kavadip. I wish us successful.
Thank you very much. And I think the last point is very important. We are here for the World Health Assembly. Let's get our voice across to the high-level political decision makers to understand what we want, our patient preferences. And let's work collaboratively. I think Dr. Tedros very nicely said that it's got to be in national unity and global solidarity that we overcome the pandemic. And I'm so proud for Dr. Tedros' leadership that he saw us through one of the worst periods of humanity's history. And we have been gladly told last month that the pandemic officially is over, but we have to keep vigilant. And now I would like Dr. Sinad to please come on board. A small photograph, and then we'll ask you to open your address, and thereafter we will carry on this pivot. Thank you. Come over, please. The board members here. Thank you. Thank you very much. Please do. We will have a group photo later on. Okay, thank you. Please do come through there. Could I invite Penela Gunter, please, on stage? Thank you. Thank you very much. I don't have to introduce the minister because I think many of you have already looked at his portfolio and looked at what they've been achieved. But as I said, currently Kiribati has been working intensively to introduce new innovative health technologies into the island. They've improved public health enormously. And yes, they're facing challenges. As I said, climate change has brought new challenges to Kiribati. The pandemic hasn't helped, but it's got a big heart, and its openness and its willingness to collaborate with international organizations, international and non-state actors, especially like patient groups like ourselves, has made it a very ripe country to start from if you want to start changing the world. We're in a room. It's called the Gandhi Room, and it's not by accident. Mahatma Gandhi said that be the change you would like to see in the world. So this is why we are here. We would like to be the change we would like to see in the world. Having introduced Honourable Minister for that, I will now ask Penella Gunter next. Penella, you might have seen in performances at the European Union. She was a Member of Parliament from Sweden. Penella, as a patient, has really voiced the patient voice in the European Union, has led us in thick and thin, has been a great champion for the European Medicines Agency and our presence there. And Penella has always, used the elbow to make room for us in all the various forums in European Union, be it industry, be it in regulation, in public health, in genetics, in biosimilars, guidelines. Thanks to her, we got on to that. And that's a model way of getting that high-level political commitment and support. Penella also has been like a leader in forming all-party parliamentary groups for patients to engage with parliamentarians jointly. So she will be the respondents. So I will ask the minister to start his speech. And Manish, can you hear us back in India? Can you? Thank you. We have been controlled from India, so this is the... And also I would welcome 360 odd patient groups that have joined online, and the rest 200 who are joining in a short while. So we do have about 660 patients online joining us. Guys, please welcome. I can't see you, but I can feel you in spirit in the room. Welcome everybody, wherever you're. Good morning, good afternoon, and good night to others. And especially if Kiribati patients, I'll get sent an email to them as well. So I would like the minister to start the presentation, and thank you.
Thank you very much. Can you actually hear me? Yeah. Thank you very much, Chair, for that wonderful introduction. Just as a disclaimer, he's been advertising a lot for Kiribati. We have not been paying him anything, so he's not under any undue influence. But before I start, I'd like to convey the warm greetings of my government, my president, the government of Kiribati, situated in the Pacific. We've got a few slides as well, and I'll just try and take you slowly through the talk, educating you as well, hopefully in my small part of the world. But members and stakeholders of the International Alliance of Patients Organizations, colleagues, distinguished ladies and gentlemen, Kamnaben in Maori, and Kiribati greetings to you all. Just as a prelude to all of this, I wonder if I could get a show of hands on how many people in the audience actually know about Kiribati prior to this meeting. 3. That's good. Less than a handful. Excellent. Well, Kiribati, as you may or may not know, and I wonder if I could get the next slide put up, please. So this is it. This is us. This is Kiribati. We are an archipelago of about 33 islands. We actually straddle all 4 hemispheres. So we're across the equator and on the international date line. So we actually occupy the north, south, west, and east. And as you can see, we're a very tiny nation. We're a nation of ocean. We're mostly ocean. But nonetheless, we are a nation of people and a nation of people with genuine feelings and genuine sincerity for the world. We have a population of about 110,000. And I always recall when I was in university, and my colleagues always, upon telling them of this fact, they always used to tell me that I was an endangered species, less than 100,000 back then in early 2000. But we are at the forefront of some of the worst challenges of climate change and climate-related health changes that we face as a people, as a nation, and as a united globe. Yesterday, me and my team, and I'm very grateful for the team that have accompanied me on this trip, my secretary Benny and Director of Public Health Edisi, we witnessed the massive flooding in Italy. The same could be said during my official visit to Australia in October of last year. And our thoughts are with the people of Italy as they go through these challenging times, in the same manner that I shared with the Australian Health Minister during my visit last year. Kiribati, as a nation, faces a very different type of flooding. It is one where the sea that surrounds our islands slowly creep up, naturally taking over the lands that we've lived on, never receding, yet ever so increasing. And we, as a nation, need to be innovative. We need to continually explore ways of maintaining our resilience and to open up the doors of opportunities that these challenges present to us. But today, ladies and gentlemen, my talk is not on climate resilience, but rather on our ability as human beings to explore, to engage, and to ultimately improve the health of our nations, innovation, and research. For the last 2 years, the percentage of my government's budget destined for health we actually look at the value of the dollar, the health dollar per capita, and these are all data extracted from the World Bank in 2019. Kiribati spends about $172 per person for health. This is in comparison to our bigger neighbors, Fiji, $236, and our largest partners in the region, New Zealand, $4,200, and Australia, $5,100. It is therefore not a surprise that we, as a country, suffer from some of the region's worst health statistics. Maternal mortality rates, under 5 deaths, rates of TB, rates of leprosy, and these, ladies and gentlemen, will be covered with a bit more depth during the course of the talk. My speech today will focus on 2 main innovative approaches that we as a government, in collaboration with our partners and collaborators, are attempting to embark on to help fulfill the UN's SDG goals, number 3, of improving health, and number 17, partnerships for the goals. But more importantly, at the heart of all this is to improve the lives of our people. The first that I would like to share with you is a program known as the Wolbachia Mosquito Program. From 2018 and prior, dengue fever and chikungunya have been problematic, mostly on the urban island of Kiribati, named Tarawa. This has unfortunately resulted in previous years in a number of fatalities. In 2019, my ministry partnered with the Australian government Monash University, and the World Mosquito Program to introduce Wolbachia-infected mosquitoes onto the main island of Tarawa. If we actually look at Tarawa, it's actually where 50% of the whole country lives. It is densely overcrowded, and on the electorate where I stand, it is probably one of the most densely populated regions in the world. Fortunately, during the program, there was good coverage of Tarawa. However, the Wolbachia mosquito ceased due, as we know, to COVID-19, and therefore a large part of what I will call the eastern part of the island remained Wolbachia free. As a result of this relatively simple intervention, we have not seen a confirmed case of dengue or chikungunya on the densely populated western side since the introduction of the bacteria. In contrast, last year in July, we had a period of heavy rainfall, and on the relatively Wolbachia-free eastern part of the island, we saw an outbreak of 3 confirmed dengue fever cases. And I'm sure, as you are all well aware, the WHO classifies a single case of dengue as an outbreak. So this, ladies and gentlemen, I believe shows that even though the most highly densely populated parts of my country can be affected by something that I think is relatively simple. It is a very amazing piece of innovation, introducing bacteria into mosquito. But introducing a bacteria into a mosquito, which then prevents the mosquito from spreading diseases such as dengue and chikungunya and so on, I think it is hugely innovative. And my hats go off to the researchers at the Monash University in Australia, to the Australian government for their part, and also again, and hopefully by the end of next year, we have a good range of coverage for Wolbachia on the urban island, and hopefully that will see the relative end of dengue or chikungunya outbreak. So that, ladies and gentlemen, is the first case that I'd like to share with you. I think it highlights a degree of partnership, a degree of trust, a degree of sincerity, and we are grateful for the aforementioned partners in the work that I have just mentioned. The second, ladies and gentlemen, that I'd like to share with you is on organizational partnership. I'll share with you some data. As of 2019, based on the World Bank figures, we had a maternal mortality ratio of 108 per 100,000 live births. This is compared to 7 for New Zealand and 8 for Australia during the same period. Under 5, mortality rate of 51.4 per 1,000 live births. These again are all figures from the 2019 World Bank data bank. During the same period, 5 for New Zealand, 4 for Australia. We have a TB incidence of 436 per 100,000 people. That's pretty much the whole country. And a leprosy incidence of over 200 cases per 100,000. Kiribati, ladies and gentlemen, has one of the Pacific regions, if not the world's worst health statistics. And those are some that I have just shared with you, the 4 data points. There are obviously many more, which I will not have time to discuss during this speech. This is most unfortunate, and for some, if not most, of these statistics, they have been this way with very little change for the past decade, or the last 10 years. So clearly the need for change is evident. To not do the same thing over and over again and expect a different result, is a famous quote from the infamous Einstein. But how do we as a nation, with our limited health dollar being pulled in so many directions, initiate, let alone maintain the positive change that we need? One of the strategies that this government has initiated organizations with the right skill set and the right know-how in an attempt to make a small positive change, targeting a few of these statistics and approaching them in small strides. It's almost a page out of a change management course 101. In October of last year, I signed off on an MOU between my ministry and MSF, and I apologize for my French because I'm very good. Médecins Sans Frontières, working in partnership to help address our maternal and newly born statistics in the most southern and hard to reach islands within our archipelago. I believe this is the first time that MSF, with its vast resources, have agreed to help a country that is not in a state of crisis, although based on the previous facts, you could argue otherwise, let alone a country in the middle of the Pacific. And we, the government of Kiribati, are most grateful for their contribution to our people. Next month, on behalf of the government, I will sign off on a novel initiative between New Zealand Plunket Nursing and my ministry, with support from the New Zealand government. For those of you that are unaware, Plunket New Zealand has been in existence for over 100 years, maintaining its community-based nurse-led programs to help maintain, and I emphasize, the wellness of children under the age of 5 in New Zealand. Medical care in Kiribati, for the most part, starts and ends when the patient is either at the hospital or the clinic. We do not have a community-based health program that responds to both the health needs of the child or adult, as well as encompassing those of the wider extended family. This approach, we envisage, will address the needs of the child with issues such as problems with breastfeeding, identification of domestic violence, and so on. Most diseases, as you know, begin within the setting of the home. And yes, we are all in need of a strong emphasis on health and well-being, rather than disease and managing the complications. As the saying goes, prevention is better than cure. Just yesterday, my team and I returned from the Czech Republic, seeking their help with our hospital infrastructure and partnership in non-communicable disease novel approaches in collaboration with the University of Auckland. The signs are positive, but we are yet to see the fruits of this work. I am not going to make outrageous comments that all of these pilot initiatives and partnerships that I have just mentioned are going to solve all of the problems that they were meant to target. We need to be pragmatic. But it is through these genuine relationships that we all come together with the best of intentions to make a positive difference. And as I keep saying to my newfound colleagues, if you're able to solve a problem in Kiribati with its vast ocean geography, relatively small population, and challenging environmental conditions, then I know that as a race, we are one step closer to solving it for the patients of the world. A truly ambitious goal through a relationship or relationships that are built on foundations of trust, goodwill, and the need for positive difference in the lives of the people that depend on us, depend on the systems that we create. This has been a profound journey of humility. Sorry, I actually got carried on there. Can we get the next slide, please? Apologies. This was actually meant to go with the part about the under 5 mortality rates. And then the next one, please. Sorry, I'm just doing catch up here.
You got so passionate in hearing. Absolutely.
But these, ladies and gentlemen, are the face of the people They are the face of our people, the face of your brothers and sisters in Kiribati. This has been a profound journey of humility, of learning and of evolving, of personal change and of change in the way that my country needs to forego in order to improve the health of its people and, in extension, to the rest of the world. Could we get the next slide, please? Small as we may be, this is actually a picture of the current infrastructure, the hospital and the clinics that we have. Small as we may be, or an endangered race, as mentioned earlier, I hope that these can be the contribution of my people and my nation to the world of innovative change and research in the quest for positive health change. And the last slide, please. Sorry, the last one after this. With these words, please allow me to bestow upon you, upon us all, the rich blessings of our ancestors. Te Maori, good health. Te Roi, peace. O Te Tapamoa, prosperity. And the final slide, sir. Kamrapa, I thank you all, and I would also like to take this amazing opportunity to invite you all to come and visit my beautiful country, a very small part of the world. Thank you, ladies and gentlemen, and have a wonderful rest of the workshop. Thank you.
Thank you, Minister. I think that is what we needed for this World Health Assembly week. Remember the saying that no man is an island. Ask not for whom the bell tolls. You're saying the last chance for us. The bell is tolling for us. Secondly, when you mention the statistics, I always say every statistic is a patient. And we heard that today. We are relating to your patients. And we have heard your call. It's like the conch shell that you blow to call across. We have heard the conch shell from Kiribati. We'll respond and we will meet in Kiribati. And secondly, I think the most important part, my alma mater is London School of Hygiene and Tropical Medicine, where I did my MSc in Public Health. Ampert was one of my lecturers. And he always spoke about malaria and controlling of malaria and innovation. The true measure of humanity will be when we eradicate malaria, because that is what we have achieved. And now is our call to action. Now, it's my great honor to get the minister's message into the European Union, 28 countries and wider, through, again, Pernilla Gunther. She has been a great activist, great personal friend as well over time. Pernilla, over to you. Let's see you respond to that and see how we can generate everybody who's listening online, how we can meet in Kiribati next year, but also drink to your health this new year. Sorry to continue with this. In every culture I go, they've never ever talk about other things than just to drink to your health. Go anywhere. They will drink to your health. So to your health, how would you address this, Pernilla? Over to you.
Well, thank you so much. And I'm not sure I can really, meet your expectations here. But to drink to your health, actually, I'm a really champagne lover. So if anyone would love to invite me to that, I'm open to it. I'm very honored to be here because I think one of the most important things we can really face right now is the quality of healthcare. And quality of healthcare impacts us all. We can always, sometimes in life, become a patient. And of course, there can be for a short period some accident that will heal some, very quickly, or you can be it for life. I'm one of those who have that kind of experience to really have a, well, lifelong experience. And I would like to think as it as an experience. But being a patient, it's not only what I am. Since my first name is Pernilla, and I've been a politician, I'm also a professional. So the fourth P is being a patient, yes, but that's not all of me. But to use all the skills that we have as persons, really, to make an impact on healthcare, we should always use not only the patient experience, but to use that when you can, and to use it wisely. And to be listening right now to the minister here, and to hear what, at least what I was hearing, and I hope you did the same. When there is a will, there is a way. And when you have that kind of will, when you would love to work together with other people, when you love to network and to create relationships that also last over time, not to have a quick refund of something that you would like to achieve right now, but to create relationships over time that really make a change. That's really the challenge, I think, also to really improve healthcare. And I think during my experience also from being a policymaker, I think that sometimes it's all about the peace today. I hear it. It's really to think of politicians and stakeholders as people. What kind of experiences do they have in their life that really can make it work when you talk about patient improvement, to influence healthcare and treatments, to really gain from new research and get new drugs out to the market and so on. When I was an MP, I created a network called the Network for Equal Care, because it was something that really engaged people. And because I had experienced that, and I think the minister and some other of you have experienced that people come to you and have a wish list of all kind of things. And they came to me from patient organizations, life science industry, authorities, agencies, and so on, and said, Pernilla, we really would like to have this and that. And I often was thinking, after a long day of meetings, that why cannot they talk to each other and come to me as one and say, this is what we really would like to achieve. And I was so surprised that when I heard other MPs from other parliaments and well, in Europe and other countries, that they experienced the same. And I think that is really something to think about. If we have the same goals, if we like to achieve the same things, to improve healthcare and to ensure quality in healthcare all over the world, we need this what the minister was talking about, to create all these relationships. And do not be afraid to really make contacts with organizations and agencies and so on from all over the world. I was so thrilled to hear, I mean, you've been in Slovakia? No? Prague it was. Yeah, sorry. I mean, that's quite far from your country. And still, you can make these relationships work because we have opportunity nowadays in the world. And I can also see similarities between your country and the Sweden in the rural areas. Sweden, it might be a small country, but it's very big geographically. And in the rural areas, we are developing nowadays quite good digital tools to ensure healthcare also in these rural areas. And I've also been to Greenland, a huge area, a huge island, the total opposite, I would say. But it's also have some kind of great experiences from work within their healthcare. So, but just to go back a few seconds to this network I created. Because when I organized meetings in Parliament for all these groups together, they were quite surprised from the beginning. Oh, isn't it all only about CVDs or only about cancer or diabetes or something? No, you're here to talk about equal care for all. We need this for all. And how to create this. And to be a part of a conversation or discussion, you know, to be an equal part at the same table. That's not always what patients have discovered. They have not always been appreciated to be an equal part at the same table. So to be invited, it created a huge interest. So when I left Parliament, I have continued really to work with this initiative, and now it's called Focus Patient, because everybody, you know, is talking about putting the patient in focus. So I think it's quite a good name. Because we still need to create these networks and to be able to build communities to ensure people to have an equal right to healthcare all over the world. It's not only about our organization, what we are working for, because you can see the same need for others in their area of diagnosis. And I think when you try really to make contacts and people do not want it, okay, I think that's their loss, really. Because if you see the advantages really to make these networks, you can really see a result as well. I will stop there, but I think to just emphasize the importance of patients and to be a force to the society. If everybody should really join forces to create a better healthcare all over the world, we should see results. And maybe we should all go also to support the Minister of Health in this. Let's start with that. I would really enjoy to go to your country and to be of any help if I can be of any assistance, and we can do it together. Thank you so much.
Thank you much, Pernilla. We are keeping in honor to Switzerland and its timekeeping. So 9:45. We must please the gods of timekeeping. This was not by accident why we chose the two speakers. Reason was that Sweden is also known as a country with 1,000 islands. Keras, none of them. Sweden is also the nearest country to the North Pole and the Northern Arctic Circle. Freezing cold, warm hot. But to conclude, one of the traditions was saying that we have had Pernilla and yourself. It comes from William Osler, who said that general practitioners, I'm glad Tessa is there and she will comment on this as BMJ editor. He says that doctors who refuse to consult evidence-based books, etc., and don't learn from them, are sailing on choppy seas. Sea metaphor, yeah, for you. But he says doctors who do not learn from patients are not sailing in any sea whatsoever. Okay, so that's it. And in conclusion, Minister, I did some of my medical anthropologists on the islands in Pacific. And one of the things were the kula rings. Exchange of kula rings, the rings that go in semicircle. I noticed your lapel didn't have a very important ring, and that was the SDG ring. I've got plenty of copies of this at home. So my kula ring is here for you, Minister. Please wear this in pride. And as the tradition says, we'll come and collect it by canoe for next year. Thank you very much for your time. Please have a good call upon us during World Health Assembly. And more importantly, I think we give you now the confidence to go to the Ministers of Commonwealth meeting today and talk to my king. I'm from the UK, nationalized in UK. Please talk to my king and my heads that we do need to bring the Commonwealth together in aid of Kiribati. And say, Carl Dip says this. He knows me. Thank you. Thank you. This one?